Next on Healthy Montgomery Family Checkup. One of the leading causes of death and disabilities in our country, it's diabetes. And too often it goes unnoticed. Then it could be too late.
I was put in intensive care.
We'll look at the complications of diabetes if left untreated and the simple steps you can take to lower your risk. Plus,
if you stop breathing that many times during the night over a long period of time, who knows what kind of damage it'll do.
the incurable condition affecting millions of Americans that could cost them more than a good night's sleep. And bananas, beans, and yogurt, the one thing they have in common that could lower your blood pressure and lengthen your life. All this and much more on this edition of Healthy Montgomery Family Checkup. Hi, I'm Kathy Fowler. Welcome to the second winter edition of Healthy Montgomery Family Checkup. Today we tackle the seventh biggest killer in the country, diabetes. It's the leading cause of blindness among working-age adults, and those who have it are also at increased risk for heart disease and stroke. Diabetes affects nearly 50,000 Montgomery County residents. Joyce Green is one of them, and she didn't even know it.
I was going in for the appointment and I was really in bad shape. When I got there, they took one look at me and sent me to Suburban Hospital.
Joyce Green is a type 2 diabetic, but she didn't know that when she landed in the emergency room.
My blood sugar was like 1,000 when I came in.
Doctors stabilized her
I was put in intensive care.
and immediately diagnosed with diabetes.
By the time somebody develops actual symptoms of diabetes, things are very well established or the blood sugars are very high.
I heard the words and it wasn't sinking in.
You might have blurred vision, you might have wounds that are healing poorly, you might have ulceration of your feet.
Diabetes means your body does not produce or correctly use insulin, the hormone that converts food into energy. Nearly 26 million people have the disease nationwide.
Diabetes is now regarded as probably the most significant chronic medical condition.
There are two distinct types.
Type 1 diabetes means that your body is not making any insulin at all. It usually is the result of an immune process where the body actually destroys the insulin-producing cells. And type 2 diabetes, the form of diabetes that's related to obesity, and it's the form that has really increased in prevalence over the last couple of decades.
Nearly 95% of all diabetes cases are type 2. Poor diet and lack of exercise are major factors.
We all know that diabetes is an epidemic here in the United States, and that's because we eat too much of the wrong things.
We're getting much too little exercise, and we're eating far too many calories and far too many calorie-dense foods and the like.
If left untreated, it can be dangerous.
Diabetes is a major risk for cardiovascular disease, heart attack, and stroke. Diabetes is the leading cause of amputation other than trauma.
Diabetes can't be cured, but it can be controlled.
Many of the older medications that are inexpensive work very, very well, so it doesn't have to be a break-the-bank kind of a thing to treat diabetes.
I found out that I had to do insulin in my stomach 4 times a day and take my blood sugar with every meal.
In diabetes, the person is really their physician.
You cannot sit on your butt for days and then think that your blood sugar is going to be good the next day. To me, my job was to manage my condition and to get the education. I took it on as a job.
Diabetes monitoring has even gone high-tech.
Some of the newer blood sugar meters, for example, synchronize with iPhones.
How can you reduce your risk?
If you live the kind of life you should from the standpoint of diet and exercise, we can do an enormous amount to prevent diabetes, and it costs very little money to exercise in a lot of ways. You know, walking doesn't cost you anything more than a good pair of shoes.
Talk to your doctor or visit the Diabetes Center at Suburban Hospital for more information, just like Joyce Green did.
You can actually do this yourself. It's not easy, but it's a lifestyle change that you must make for your own life.
It's important to know the warning signs: blurred vision, poorly healing wounds, or ulcerations on your feet. And there are ways to prevent it. Exercise and healthy diet are key. Maintaining one important mineral in your menu can make all the difference. Karen Owak shares the benefits of potassium.
Type 2 diabetes is a chronic disease marked by high levels of glucose or sugar in the blood. It affects 8% of Americans, or almost 24 million people, with African Americans more than twice as likely as whites to be diagnosed. Long-term complications of diabetes develop gradually, but they can eventually be disabling or life-threatening. Diabetics are more prone to heart and kidney disease, high blood pressure, and stroke. New research found that lower potassium levels in the blood are linked to higher glucose levels. Further clinical trials may one day find that you can actually prevent type 2 diabetes by increasing potassium through diet or supplementation. For now, though, a low potassium level is a risk factor, so be sure to get enough potassium through the foods you eat. Good sources include bananas, melons, beans, lentils, and yogurt. For the Health Reporter Minute, I'm Karen Owak with your quick dose of health news.
If you have diabetes, it's important that you partner with your doctor and dietitian to create a healthy eating plan that works for you. A diabetes diet is naturally rich in nutrients, low in fat and calories, and loaded with fruits, vegetables, and whole grains. Focus on healthy carbohydrates, fiber-rich foods, and heart-healthy fish. Good choices are fruits, veggies, whole grains, beans, peas, lentils, nuts, wheat bran, and low-fat dairy products. You should eat heart-healthy fish at least twice a week. Salmon, mackerel, and herring are rich in omega-3 fatty acids. Avoid fried fish or fish with high mercury levels such as tilefish, swordfish, and tuna. You should also steer clear of saturated fats, trans fats, cholesterol, and sodium. That includes beef, hot dogs, sausage, bacon, egg yolks, and shellfish. Processed snacks, baked goods, and stick margarine should also be avoided altogether. And aim for less than 2,000 milligrams of sodium a day. A combination of healthy foods, portion control, and scheduling will help keep your blood glucose levels in check. Coming up, the simple tests to determine your chance of developing diabetes, the conditions that cause it, and what you can do to prevent them. Plus,
I would have thought I was sleeping okay, no problem, except I knew that I snored.
could sleep problems cause diabetes? The link to sleep apnea and why. Next.
Get more information and interviews at mymcmedia.org/health.
If you could see anything in the world, what would it be?
I'd love to see Paris.
I like to see cupcakes falling from the sky.
To save your vision in the years ahead, call your eye doctor for a comprehensive eye exam today. Then call 1-800-437-2423 or log on to seeabettertomorrow.org to learn about glaucoma and macular degeneration.
I just want to see more of the things I love.
Welcome back. About 23 million Americans have diabetes. About 12 million suffer from sleep apnea. There's no cure for either. And as Casey Taylor reports, doctors believe having one could affect your chances of having the other.
A comfy bed, a fluffy pillow, and this. Tom Fontana slips on this CPAP machine every night just to get a good solid sleep.
My sleep studies showed that I would stop breathing anywhere from 57 to 72 times an hour.
Sometimes he would stop breathing for as long as 30 seconds. Tom suffers from obstructive sleep apnea.
If you stop breathing that many times during the night over a long period of time, who knows what kind of damage it'll do.
Depriving your body of oxygen can cause high blood pressure, heart attack, stroke, and now researchers at Ohio State University have linked sleep apnea to type 2 diabetes.
Sleep apnea worsens glucose control and worsens the
body's responsiveness to insulin.
Oxygen levels fluctuate throughout the night, causing fat cells to become resistant to insulin, which may cause glucose levels to rise. This can lead to diabetes and other cardiovascular problems.
Every time their oxygen level drops, their blood pressure goes up. Their adrenaline surges in the body. The heart starts working hard against the elevated blood pressure.
Lou Flocken knows the health risks associated with his sleep problems.
I would have thought I was sleeping okay, no problem, except I knew that I snored.
Lou has high blood pressure. Using a CPAP along with medication, his blood pressure has dropped from 150 over 100 to 120 over 80.
Getting a quality night's sleep is one of the things that I've been focusing on to try and make sure that I stay healthy into the future.
This is Casey Taylor reporting.
A study at UCLA found that adults who suffer from sleep apnea are 3 times more likely to have diabetes. The most common sign of sleep apnea is snoring and daytime sleepiness. There's another medical condition that can put you at higher risk when it comes to diabetes. It's called metabolic syndrome. Dr. Shabnam Dadgar, a primary care physician who specializes in minimally invasive surgery and gynecology care in Rockville, Maryland, joins us now with more in today's Healthy Women.
Metabolic syndrome is any disease or condition that will lead to diabetes or heart disease. Having one, or the other are as dangerous to our general health.
Why do you need to know if you have metabolic syndrome? Why is it important to identify that patient population?
There are few ways that we can diagnose metabolic syndrome. High blood pressure, high cholesterol, waist, how big is your abdominal waist is about 35 inch, bigger than 35 inch in women, and weight, and blood sugar, diabetes. So any 2 or 3 of these, depends on which guidelines and you're looking at to diagnose metabolic syndrome, will label patient as having the syndrome.
What tips can you give to people who have been identified or diagnosed with metabolic syndrome?
Again, it's very important to closely check and watch, and if they do have the complications and they have them, they need to be treated. And then weight loss is very important, because a lot of times, losing weight itself will control a lot of problems that are associated with metabolic syndrome and insulin resistance.
Having diabetes puts you at major risk for stroke, so it's important to know the warning signs. As Casey Taylor reports, one man's family used their stroke IQ to save his life.
Filippo Lombardi grew up working hard. He was a father of 8, a farmer in a small Italian town.
There was only 2 bedrooms. They used to cook on a fire.
But what the family patriarch learned in that life helped him build a restaurant in his new life in New York. The cooking, the books, the reservations, the recipes, all a family affair.
So it really has kept us all very close, and that's really the key.
It didn't take long for this close-knit family to notice something was wrong.
We noticed some slight differences in the way he was walking and the way he was moving.
Filippo's carotid artery was closing. How much do you know about stroke? True or false, the best sign of stroke is paralysis.
It can not necessarily just involve motor weakness, but it can also involve numbness, can involve seizures.
The most common stroke symptoms are weakness, vision problems, sudden difficulty speaking, unexplained dizziness, unsteadiness, or loss of balance. True or false, smoking will not affect my chances of having a stroke. Tobacco smoke actually doubles your chances of having a stroke. One more, if stroke symptoms pass, you do not need to seek treatment. The truth is, sometimes people will have symptoms that disappear within a few minutes. 1/3 of people who have a mini stroke eventually will have a stroke. Today, Filippo is back in the kitchen.
And he recovered 100%. I mean, it was 100% recovery.
And back with his family where he belongs. I'm Casey Taylor reporting.
Age also matters. When it comes to stroke, the risk of having another more than doubles each decade after the age of 55. We hope this edition of Healthy Montgomery Family Checkup was educational and informative. For more information on these and other health-related topics, simply visit one of these websites. We'll be back next time. Until then, I'm Kathy Fowler. Stay healthy, Montgomery.